We have a little bit of information we'd like to step through, but mostly we'd like to just answer questions. So again, this is Professor Benny, and most of you, well, all of you I've talked with at one point or another. And then we did an orientation phone call about a month ago. And I know there's some new people with us since then, so I thought I would go over just a little bit of the structure of the summer internship program. And I have some of our students. I have Corey with me and some of our students. I'll let you guys just introduce yourself real quickly.
I'm Alexa. I am a sophomore at Northeastern, and this is my first co-op. And so we're about 2/3 of the way done now with our co-ops, and it's going really well. So I'm part of a committee that's trying to make sure that you guys have a good time when you get here.
I'm Annie. This is my third co-op. I'm a junior here at Northeastern. I'm not on this committee, but I hope you have a great summer internship, and I'll be here for it, so you can come and ask me questions.
I'm Corey. You've heard from me a bunch already.
Yes.
So we formed an internal committee of students to improve and do some quality improvement on our own processes and try to improve the transition as new students come in and as they depart. So, and I also think Alexa and Annie will probably be able to answer questions more about like what they're getting out of this experience and what a typical day and what a typical week is like. The life of a student in our midst. Here's what I'd love to cover, which is just go over a little bit of logistics. And at the end of this, make sure you have Corey's contact information, which I know all of you do. But just a little bit of the logistics and a little bit of sort of spring pre-work to set up and get things going. And then really, this will take, I think, 10, 15 minutes. And then just take totally the rest of the time and hear what questions you have and just have some general Q&A and discussion. So that's how I'm hoping this goes. Don't be concerned about the homework assignment, the reading assignment, and the writing assignment. It's just we want to do a little pre-work. We run a fairly large institute focused on applying industrial engineering to really the whole spectrum of healthcare problems, healthcare delivery systems, keeping people out of healthcare delivery systems, like home health and population health, and even some medical decision making. Everything from very, very applied frontline process improvement work through complex operations research, mathematical modeling type of work. So that's the platform on which, on top of which or underneath which, supporting which we have all sorts of folks involved, faculty, engineers, staff, and students at every place in their progression. Undergraduate students, graduate students, postdocs, kind of the whole kit and caboodle. So my hope for everybody, summer interns and everybody here, is that they leverage all of the research we're doing and the applied work we're doing, contribute to it, help with it, certainly. We need help with it, but also use it to learn and grow and sort of figure out their next direction. So again, this image you're looking at is our kind of conceptualization of what the summer internship program is. Most of it happens during the summer, hence the name, but there is a little bit that happens in the spring and hopefully a little bit that happens in the fall. So the summer is really when we're doing projects and you guys are all here helping in one way or another, but we need to do a little preparation for that over the next month. And then after everybody returns to Penn State or Clemson or Wisconsin or Pittsburgh or Buffalo, et cetera, I'm hoping that we can stay in touch through a monthly conference call and collectively figure out what would be a good thing to be doing, and maybe the student committee can help us with this. But I want to stretch this learning experience into the fall with a little bit more reflection and even a little bit of writing up the work we're doing and that you've helped with, and see what we could submit as posters or presentations to the Industrial Engineering Conference or wherever. So let me talk through the spring, the summer, and the fall a little bit. So here we are in the spring. This is the second of 2 orientation calls. The recordings of these and the slides are posted. Well, the first one is. This one will be posted on our website, and we'll send around the links as a reminder. So all this is here. The 2 things we need to do over the next month. Most of you will land here the day after Memorial Day, May 27th or 26th, Tuesday after Memorial Day. So we need to do 2 things. We need to do a little bit of homework, no big deal, and a little bit of onboarding. So the homework, and I'll expand on this on the next slide, is 2 papers that we're going to circulate by email. And I think it would just be, you may have seen this already, and it may be new to you. But a paper that describes what the triple aim is, and then a summary paper that just gives a good survey of how industrial engineering is applied in healthcare. And I think it'd be good just to skim those or read those if you're an industrial engineer who's been working in healthcare. I apologize, and if you're not an industrial engineer or haven't been working in healthcare, it's good to look at. And then a little bit of writing. The gist is writing, and I'll explain this more in a minute, but writing 1 page on your experience so far working in healthcare and what you really hope to get out of this experience. Because then at the end of the summer, I'm going to ask you to reflect back on to what extent we met those goals. So the other thing, and I'll go back to the reading and the writing in a minute, but the onboarding, this is one of the major hassles of trying to help healthcare improve. You find a colleague in a health system and they say, wow, great, we'd love your help. Now, for us to actually walk the halls of some hospitals, it's not as easy as just going over and collecting data and observing. Different health systems have different requirements, but most of them require some sort of onboarding, some sort of training, some sort of verification that you have sat through an orientation of what HIPAA is and agree to comply to it, and so on. How much of a hassle has it been for you guys?
There's a lot of delay.
It just takes a while. It's not difficult. It's just like it's a few forms you have to fill out, and the HIPAA training took like 20 minutes. So it's not hard to actually do it, but the time delay between when you finish those things and when you can actually start, like you're actually onboarded, is like 3 weeks.
So we're going to reach out to you guys who are coming here for the summer with anything we can do in advance in terms of onboarding. There may be a uniform HIPAA training that some health systems will accept. There may not be. But it'd be good for everybody to know what HIPAA is, the Healthcare Information Personal Protection Act, and why it's important, why health systems want us to verify. Then there's some onboarding here at Northeastern University, just to work here as an employee, which all the summer will be. There's an I-9 form, there's a direct deposit form, there's the link you go to request a computer account, and what else is there?
W-4.
The W-4 for taxes.
Yeah.
So these are the 2 things we need to accomplish over the next month, is taking care of all this paperwork stuff as much as we can. One thing I would mention, if anybody's had to get a TB shot recently, and if you have a record of it, to bring it. Some health systems would accept that. Some would want you to get TB screening all over again, even if you have a record of it.
Having a medical record of, like,
Immunization record.
any immunization record would be helpful to try to find before getting here.
Yeah. So could I ask, like, the 3 of you or the 2 of you and the student committee to put together the list of everything that people need to do?
Definitely.
And what links they should go to and what forms they should fill out and so on because we have a month, and it'd be good to get most of this done with. First week in the summer, there'll be kind of a slow week. Isn't your first week here kind of slow?
Yeah.
Too slow. So let's figure out what we can do.
We're working on that.
We're working on it, right? But what we have planned for the summer interns is 2 hours of orientation each day. So it's going to be a 4-day week, that particular, most people. So orientation on what we do and how we do it and all the logistics, that's day one. Then some stuff about the triple aim and industrial engineering and basic process improvement stuff, day two, and so on. So the first week is somewhat occupied with just getting your feet wet, finding a cube, finding a chair, finding a computer, all that business. But if on day one we're taking care of any last project assignments, we can immediately start the onboarding in the health system and then just twiddle our thumbs for a week or so. So we'll try to get most of that taken care of in advance, and it's just something we need to weather. So so basically this is the work we need to do in the spring. Now, a lot of what we're doing is organized, or at least packaged in the language of this thing called the triple aim. So some of you have heard the phrase, some of you may not have. So the concept of the triple aim is, what do we all want? What describes good? So what describes good is better care if you're in the healthcare system. So that's a better outcome, survival, better care, safer, fewer adverse events. No accidents happen to me when I'm in the healthcare system. Even the whole care experience. I'm more satisfied. I see the doctor I wanted to see when I saw them. I didn't have to wait a long time to get in. I dialed in for a conference call and it started on time and didn't have a lot of feedback. Just an overall better experience. That's better care. But it'd be good if we didn't even have to have that experience. So better health, so we don't need to access the system so much. And if one does this right, better care and better health, it should happen at lower cost. That's what's called the triple aim, and that's what we want as a society. Better care when we need it, better health so we don't need it, and all of that at lower costs. It's easy. One can achieve better care at higher cost and better health at higher cost, but that's not the concept of the triple aim. Like, one could have a safer health system by having 10 different people double-check my medications to make sure I don't have a medication error. That's not the triple aim. That's an expensive way to ensure quality. So this concept of the triple aim is an important phrase to know because everybody's talking about it in healthcare. This is just an example of the triple aim, where you have a diabetic population who have to come into the healthcare system too frequently and use the healthcare system because their health is not good. So if we could maintain a registry or help diabetic patients stay healthier in their home, they'd have better health. They wouldn't need to come into the care system much. So access would be better because there'd be fewer people trying to visit their endocrinologist and their primary care provider and so on. And because there'd be fewer visits, all of that would happen at lower cost. That's kind of the concept of the triple aim. So here are one of the two papers that we're going to send around. This is, I think, the original paper about the triple aim, written by our colleague Don Berwick and Tom Nolan and John Whittington, all one way or another associated with the Institute for Healthcare Improvement. That'll just give you the background concept and context with examples of the triple aim. So I'm pounding on this a little bit because every day we're talking about, should we do this project or that project, or should we not, or so-and-so has a new project idea, somebody called us from a health system. And we say, well, how would that improve the triple aim? Help me understand how care would be better, how health would be better, and or how cost would be better. So if you're not sick of hearing the phrase yet, by the middle of the summer, you'll be tired of hearing the phrase the triple aim. But it's fundamentally important. The other paper we're going to circulate is one of two papers, or three papers, we haven't really picked which one, which is just an overview of how historically industrial engineering has been or could be applied to healthcare. That's it. That's your kind of background reading assignment. And then if you skim these papers as they come into your email, that would be, I think, a good amount of prep. Now, Corey, did you want to talk about what the writing assignment is?
I mean, just briefly, just a quick kind of pre-flexion, as we're calling it, just to kind of get a background of why you want to come here, why you want to be an IE, what an IE in healthcare. What do you know about healthcare and its problems and the triple aim and just kind of everything like that? It should be fairly simple. We're going to keep it just to a page, so you don't have to write that much, just probably 2-3 paragraphs at most.
Do we have a template?
Yep, so I'll send that out later today.
Okay, perfect. So you're kind of, for the people on the phone learning my style, I've got this concept. I'm trying to delegate as much as I can because most of you know I'm a bottleneck. And we have a great team of staff and students here, so I have no doubt about the quality. So very simple is how you're going to keep it, right? Just one page. And so we want to do this to everybody for a bunch. We really want you to think and in advance reflect, you know, why you want to get an experience like this. But at the end of the summer, we also want to sort of, okay, it's 2.5 months later, how did it work out? And sort of do that contrast. Did I really get out of this what I want to get out of it? And then the other reason is just the logistics reason. I really want your help with this. It's a way for us to evaluate and also show that we're trying to evaluate the program because as a faculty, a big piece of my life is seeking grants to fund things like this. And so building in some evaluation of the program allows me to ask foundations for money to continue to support the summer internship program and having some structure around it. So let's talk about the summer itself just real quickly. Now, most of you, and I know there's been dialogue back and forth, and Corey probably is more on top of the specifics, and it's completely okay by me. Most of you are coming the week of May 27th. I know there's a little bit of people coming a week early or a little later just based on personal calendars. But that's, for most people, the orientation week, and then followed by another 9 weeks, I guess, of being here. And then some of you, I know, have to leave a little early, and some of you are going to hang out a little bit. That's wonderful. We're pretty fluid and go with the flow. That's the summer, and I've talked with, I think, just about everybody about how we work. We work in teams. How many teams are you on?
A lot.
A lot.
I'm on 3 applied projects, 1 research project, and 2 internal committees.
Wow. How many did you start on?
I started on 2 right off the bat, the 2
Yeah.
MGH neurology projects. They kind of go hand in hand. So I was actually lucky to be on 1.
Right, with the same system.
Right. Yeah.
And then it wasn't really occupying 40 hours a week.
No, it wasn't.
Right.
That's why I've added many more things.
Yeah, I didn't know you had that much going on. So typically we start everybody with 2 projects, and then if they're overloaded, which I've never seen with 2 projects, we would lighten up. Usually some projects just move so darn slowly, so we try to get you involved in a 3rd project, or you just find other projects to help with.
For things.
Yeah. Annie, how many are you?
I'm on 2-ish projects. I'm working on MGH neurology, and I'm working to do the simulation in Harborview.
Yeah, that's kind of what I wanted people to hear. Is it's sometimes you do an internship or a summer thing, and you have 1 project, and that's just your thing. This is things get busy, things get slow. You sort of adapt, get involved in other work. Ideally get involved in some internal team to help us improve, because that's really key to me. So down here where I say weekly rhythm, does this roughly capture your week?
Yeah.
How much of your time do you spend here at some health system?
I spend most of my time here. I only, with the diabetes project, we're not actually meeting with the system yet, so NGH is the only one that I actually am going to, and it's normally like twice a week for an hour or two.
Okay.
So not much.
Well, we should work to increase that. You were like living at Dana-Farber.
Yeah, I used to spend like half a day-ish at Dana-Farber every day, and now I'm here more.
Right. So that's the summer. And if you joined us for the first orientation phone call, there are examples of projects in those slides. If you didn't, we'll include a link to follow on email. So this is just a summary to give you kind of a feel for the types of stuff we're working on. So then, that's not right. I didn't even update the fall slide. So then, in the fall, what I would love to do, and we could even brainstorm about this during the summer, but my idea in the fall is we might have a monthly conference call to debrief a little bit about projects and to work as a team on anything that we feel would be useful to work on. One thing might be, now that we're back at wherever we came from, how could we help Northeastern improve this for the next cohort? Another thing might be, a bunch of us are going to the HSyE conference to present some of our projects. What did we do during the summer that we should submit as posters to the Society for Health Systems conference or the Industrial Engineering conference or some other conference? But I feel like we should extend into the fall and experiment with that a little bit.